Today we'll be talking on cervical cancer. To begin, cervical cancer is the growth of abnormal cells in the lining of the cervix. So looking at the signs and symptoms of cervical cancer, we'll be looking at one, a longer or heavier menstrual flow. That's to say, your menses flows longer than normal or it comes heavier than usual. So, in the previous teachings, we talked on how you could properly understand your menstrual cycle and how your menses flow. So with this understanding, you'll be able to dictate if the color of your menses is normal, if the flow rate is normal, and if the duration of the flow is actually normal. So it's important. Another thing is pain during intercourse. There's some people, they can't properly enjoy intercourse. Yeah, you have pains during the process and you have pain after the act. So it's good to go for a check. Another thing is changes in the vaginal discharge. It's important or it's normal that a woman should have a slight vaginal discharge. But it becomes problematic or a call for concern when it becomes smell. You know when it smells or the color changes. Maybe it's dark, bloody, brownish. So it's important you check the color and the nature of your vaginal discharge. That being said, we'll go to some of the risk factors of cervical cancer. What is that thing that could make you be at risk? That will make you to be vulnerable, susceptible, exposed to having cervical cancer? One, smoking. Oh, it's important you know that smoking could actually expose you or make you at risk to have cervical cancer because the ingredients or the chemical components that is in cigarettes will actually or its potential to damage the DNA of the cervix. And when this is being done, you will therefore be exposed to cervical cancer. Another thing here is chlamydia. And then you be like, chlamydia. Now how chlamydia concerns cancer? Let me tell you. Now, when you have chlamydia, especially when it's been left for long untreated, what will happen is that it will cause inflammation and possibly enhances a development of the growth of abnormal cells in the lining of the cells of the cervix and thereby exposes you into having cervical cancer. Another thing here is weakened immune system. If your immune system is weak, remember your immune system is what helps you to fight against infection. So, if your immune system is weakened, your body or your system won't be able to resist or to fight infection, and thereby you'll be exposed to further infection. Another possible or potential risk factor is having an STI. And one of the prominent STIs that can expose you to cervical cancer is HPV. And HPV, we're talking about a human papillomavirus, which is an STI, a sexually transmitted infection. So it's important you take precautions on how you live your life and always go for screening. So if you come in contact with any STIs, it will be properly or early detected and handled so it shouldn't cause you further damages. Another potential risk factor is multiple sex partners and even homosexuality. Know that if you are going out or sleeping with a guy who is a gay, if he contracts HPV and he comes and sleeps with you, there's a possibility you could be infected. So when you have HPV, it's normal for you to have warts, but the warts depends on where it will come out. Where it will show you, the warts will surface determines the kind of the HPV species that you've contacted. So it's important you monitor your sex partners and how you go along the process. Don't allow 5 minutes pleasure to kill your future destiny or your future. Now, we'll be looking at how to prevent cervical cancer. 1. Get vaccinated. You should get vaccinated. The HPV vaccine will help or prevent you from having the human papillomavirus which is one of the leading cause, one of the leading risk factors of cervical cancer. Not to say, I need is sick. I didn't find it is sick. I need is sick. I need is sick. Me they're not gonna be take vaccine, but they still they find sure me we're in the 21st century. Even if you're the highest pastor, but there's a necessity for you to get a vaccine, sweetie, run, take them. Run, take them. No joke. Another thing is avoid sexual promiscuity. Sexual promiscuity. Make sure you stick to a partner. It's very important. With anything we talk on sexual health, promiscuity always comes in. It's always involved. That's why it's important. You should be stable. You should be stable. Control your urge, control your anxiety, control your desires, and be stable, be secured, and be assured. Oh, sorry, I forgot another risk factor of cervical cancer, which I left out, is oral contraceptives. When you are on it or when you have been on it for a very long time, it exposes you or puts you at risk. But I'm not saying that it's wrong to take it. No. What I'm trying to say is before you go for it, make sure you have proper counseling. A lot of us just do things without actually going through proper counseling. Because if someone just take I find for it, boom, tomorrow you start taking. And because tomorrow someone just say, I think I will not find a worry me, you just automatically stop for taking. You know, we just do things on and off without proper knowledge or counseling. It's important you always go in for counseling, whatever you want to do with your health, because your health is your life. And your life is your wealth. If you're alive, you're not healthy, you can't be wealthy. Yeah, that is it. So we'll proceed. To prevent cervical cancer, I said 1, get vaccinated. 2, avoid sexual promiscuity. 3, quit smoking. 4, avoid teenage sexual intercourse. It's so pathetic and disheartening that we are in a generation where a 14-year-old girl child is already sexually active. And to us, we think it's normal. And most of our parents will be like, it don't big. At 17 years girl or at 18 years girl, it don't big. There is a very big risk being sexually active at your teenage age. And one of the risks is the possibility of cervical cancer in the nearest future. It's not like it will surface immediately, but there's a long-term effect. Yeah, a long-term effect. So please, it's important you guide yourself. It's important you guide yourself. And before I go on to advise, especially those in the menopausal states, those who have passed menopause, post-menopause, if you are still bleeding while at your pets, they are post-menopause, it's important you go for a checkup. It could be, I'm not saying you, it could be that it's a sign of cervical cancer. I'm not saying you have, but I'm saying it could be, there's a probability. It might and it may not. So it's important you always go in for checkup. And another important way of preventing cervical cancer is to make sure you go for proper screening. Always go for screening. Now, when you go for screening and your result comes out negative, that is, you are not potentially at risk of having it or you don't have it, it's a good thing. But that doesn't mean it's all about it. Make sure that after 3 months you still go for it again. And now, if you went in for a check the first time and the result wasn't favorable, that's to say, it shows that you have it. You don't just need to avoid the doctor. Maybe they gave you a drug once and you just disappeared, you just vanished. Or when you went for the results, you went to the church or somewhere and you were prayed for, given a substance, and they told you the stuff has disappeared, you're no longer positive. True, it's good, but you still need to visit your doctor. Always do a continuous and repeated screening. Always go for screening and visit your doctor for advice and special follow-up. Don't forget, I'm your favorite girl, Marivon Agbo Freight. And in case of any question or worry, don't forget to come into my DM. I'm just a minute or a second away from you. And in case you need advice on anything, always feel free to write me personally in WhatsApp, TikTok, or anywhere. I'm always available for chat up as always. And don't forget, your health is your wealth. And the wealthiest man is the healthiest man. Thank you. Have a nice day. I'll be waiting for your questions. Please, questions and corrections, contributions. Don't forget. Bye.